Which fitting rationale do you use? Generic or proprietary? It's a question every audiologist is faced with. Today, I'm on a mission to dig deeper into Oticon's proprietary fitting rationale, voice-aligned compression, or VAC+, to see what makes it unique. Let's find out. Hi, Søren. So let's start from the beginning. Oticon introduced its proprietary fitting rationale over 20 years ago, and then it evolved in 2015 to VAC+. It's continued to advance with Oticon's technology. Can you tell me what are some key developmental milestones?
Well, exactly. VAC+ is a living, breathing fitting rationale. In 2024, when we updated the noise suppression, we optimized the loudness of VAC+ to account for this stronger noise reduction. Throughout the years, we've consistently updated VAC+ to account for all types of hearing losses and taking into account different acoustical couplings like the vented and open dome.
So compared to generic fitting rationales, are they updated as frequently?
Generic rationales are updated less frequently. Oticon products are designed to work with any fitting rationale, but we optimize the audiology and the algorithms in synergy with VAC+. The benefits of this co-development goes beyond what you can see in your standard REM and test box equipment. And VAC+ also offers some unique handles in Oticon Genie 2. For example, the brightness perception tool allows for adjustment of the high frequency gain in a convenient way, and the soft sound perception tool allows for adjusting the soft compression threshold.
Wow, so VAC+ allows for more personalization.
Exactly.
So interesting to hear Søren's perspective, but I'm curious. Do users actually notice a difference between VAC+ and a generic rationale? Let's speak with Maral, a clinical research audiologist who recently investigated this exact question. So Maral, in the pilot study you conducted, were users actually able to notice a difference between VAC+ and NAL-NL2?
They were. Participants reported a 25% improvement in their overall hearing experience with VAC+ compared to NAL-NL2.
Well, tell me how you got that result.
We had 8 test participants who were blindly assigned to 2 different groups. One group wore the hearing aids with VAC+ first and the other with NAL-NL2, and they wore the hearing aids for 2 to 4 weeks before returning to the clinic and changing the rationale and having the same experience for 2 to 4 weeks. They also filled out 2 comprehensive questionnaires covering all sorts of topics such as sound quality, speech clarity, adaptation time, and listening comfort. And then at the 3rd and final appointment, we also measured speech intelligibility index scores.
And what did those SAI measurements reveal?
They were comparable across VAC+ and NAL-NL2, aside from at 50 dB SPL, where there was a statistically significant improvement for VAC+. And of course, that's something we'd love to explore further with a larger sample size at some stage.
Fantastic. Thanks so much, Maral. Well, mission accomplished. If you're interested in learning more, check out the VAC+ white paper.